think HIE model might work in Australia in a way that's kind of contextually appropriate? Because as we all know, there's a huge big mess when it comes to funding, controls between the states and the federal government and privacy groups. This has been an intractable problem, of course, for years and years and years. Is there a model that you can see working here?
Look, I think there's a couple of things you need to do. I believe that when you talk about governance and control of data, it has to be a very, very trusted entity or a trusted group. And what that means is that I would suggest that HIEs are actually local communities of practice. So in other words, groups, maybe one in Sydney, one in Melbourne, one in Brisbane, whatever. One might include Northern Territory down to South Australia if that was appropriate, if that's where the referral patterns went. But they can't exist in isolation, because you do need to absolutely have top-down standards. You've got to have national services like identifiers, patient identifiers, provider identifiers. You must have standards about data interchange, because if I moved, just because I belong to a HIE in Melbourne doesn't mean that if I'm in Brisbane I shouldn't at least have some ability for that to be transferred. You need to have consistency across those. So I think that there is absolutely a grassroots up in the governance and usage, and there's a top-down leadership role, and I think that will give the best outcomes. So you don't want to handle a local issue at a national level, and that could happen. Now, if you're going to do everything in this great big fat national thing, then how are you going to have local governance on whether that provider should or shouldn't be in? And if they need to take an appropriate action on a local issue, then you can't handle that at national. You end up owning everybody's problem, and I don't think that's doable.
Tell me what role you think NITA might provide in that context.
Oh, clearly national standards, making sure that the national services which need to be consistent across them I believe they need to be provided. Secondly, I think in the US they have a concept of a national health information network, which actually links all of the HIEs together. Now that's not a real link. What it is it's a set of standards and policies and procedures for interchange between the HIEs themselves. So someone needs to have that role to make sure that the HIEs themselves are being compliant and are holding things at a compliant level to certain standards. Maybe so compliance I think is very much a role.